everybody, and welcome. Dan Kalish here to talk with you all about functional medicine lab interpretation. And I hope for any of you, I'm trying to make this talk applicable to the super advanced folks who've been doing this for a long time and show you some of the new things that I've been working on with Dr. Richard Lord. And then for those of you that are brand new, give you some really concrete things that you can use in your practice. Just briefly about myself. I've been doing this for 28 years, which is a little scary, but started in 1992. I'm now the lead faculty at the Institute for Functional Medicine's Practice Implementation Program, which is a mouthful. That's basically means that I'm the guy that helps with the practical application stuff. I have done some research in my checkered past. I worked with the Mayo Clinic on a research study for a couple years, and I'm working a lot now primarily with Dr. Richard Lord. And the old timers listening will know who he is. For those of you that are newer, Richard is the scientist that developed most of the testing that we now order. So Nutrival, ion panels, organic acids, the GI effects tests, those things were all out of the mind of Dr. Richard Lord 30, 40 years ago. And he's still alive, and he and I work together every week on more advanced lab interpretation and educational concepts. And it's been probably the most rewarding professional experience of my career, and personal as well. He's a lovely man and kind of a father figure to me now. We're going to talk a lot about Richard's work today. I managed to pass the IFM Certified Practitioner test thing, so I am certified, whatever that means. It wasn't the easiest test in the world anyways. Okay, so let's get into what we're going to talk about. Addressing lab-based treatments for pain and inflammation. Most of the people that we all work with have some level of chronic pain, and all the people that we work with, if they're sick in some way, have some level of inflammation. So I want to talk today primarily about reinterpreting and sort of reinvigorating our understanding and our view of the lab data that can really help us design programs that are clinically effective. Like today, not like, this is theoretically what's going on with you. I'm theoretically going to give you these supplements and maybe someday you're going to get better, but real patients who are in pain and are inflamed, how can you set up a program that's going to impact their life, now, and not, a couple months from now? We're going to review some basic concepts, but I wanted to make this kind of workshop-y so you have some, take-home stuff. But we're going to look at inflammation, oxidative stress, and mitochondrial function. Inflammation, oxidative stress, and mitochondrial function. Okay, so I think one of the most important lessons I've learned in the last 3 years of working with Dr. Lord so intensively is that all the labs that we look at exist on an arc of meaning and values, right? And that we all, in the earlier stages of learning how to do this work, you want oxidative stress to be high, and that that's bad, and you're going to give antioxidants and the person gets better. And you don't really want to know what it means when oxidative stress is too low, right? It's like that's a lot of bandwidth to think about. Well, we know that too much oxidative stress is bad, but can you have not enough oxidative? Absolutely, yeah. You can have not enough oxidative stress. That's a little crazy, right? So I want to talk about this conceptually, and I think, again, one of the things that I've learned from Richard, being the student with Richard, is that he's taught me not so much specific information, but more like a worldview and an attitude and how to look at these labs so that we can come to our own development, and we can develop ourselves as we work with patients. We can learn more and more, almost like you can teach yourself some of these things as you look at these concepts. Okay, so we're looking at deficiency states where patients require antioxidant supplements. It means they don't have enough antioxidants. But then the really big question we want to look at is, what if they don't have enough oxidative stress? How could that even happen? Well, most of the oxidative stress in the human body comes from the mitochondrial energy production pathways, right? We're making energy inside the mitochondria, and that generates a huge amount of oxidative stress. And so there are some patients that we work with that don't have enough mitochondrial energy being produced. Some people that we work with that don't even have enough mitochondria, period, and they're going to have excessively low oxidative stress. So again, giving someone an antioxidant could be bad in that situation, right? That could drive their oxidative stress even lower from a level that is excessively low. So kind of a radical idea, like not enough oxidative stress, just kind of provoking your thinking process here a little bit, so we can look at some examples of that in a minute too, okay? A common source of inflammation is low omega-3s. And I mean, we all learned this, I don't know, 30 years ago. This is not like a news flash, right? Omega-3s, fish oils, flaxseed oil can help if you're inflamed. And certainly if you've been in practice for a while, there's gazillions of people we've all treated, given omega-3s, now their inflammation's gone, now they feel better. But what about at the opposite end of the spectrum? Because we're assuming with low omega-3s that the omega-6s are kind of dicey. You know, we're kind of like a little bit of profiling on the omega-6s. Like, you know, everyone, if you're assuming omega-3s are low, then omega-6s maybe are normal or high, and you're certainly not thinking about giving people a ton of omega-6s. But what you'll see in the labs, some people that are not low in omega-3s are actually very low in omega-6s. And in a sense that we don't even really have a word for this. They're underinflamed. I don't know what the term is, but you can actually have not enough omega-6s, not enough arachidonic acid. And we always think about arachidonic as being this inflammatory mediator, and you know, the 6s are bad, the 3s are good. You give 3s if they're inflamed, but there's a certain number of patients who are going to have low 6s. Those people are going to get worse if you give them omega-3s because they sort of counteract one another in different ways. Specific enzyme pathways I can show you in a minute that describe how that actually occurs, okay? And then again, if you've been looking at NutriVals, you've been looking at organic acids tests, oat tests from Great Plains, from, I was going to say Great Smokies, but that lab's out of business, from Great Plains, from Genova, you know, any of these tests that we all look at all the time, you're used to seeing these mitochondrial markers for carnitine, for pyruvate and lactate related to blood sugar control, for things like the citric acid cycle, right? All these mitochondrial markers, and we're all trained very well that when you see these markers are high, you know that there's a problem and you want to give CoQ10 and magnesium, the things that you want to do to get the mitochondria better. But what about when those markers are all really low? What does that mean? That's always been a little bit of a mystery to all of us. And now again, working with Dr. Lord these last 3 years, we've come up with an understanding based on new research in the scientific community about what the low markers mean. And what the low markers mean is something that we call mitochondrial retraction, okay? Meaning that there's not enough mitochondria present to even make these responses. So what you're seeing on the lab are very low levels of mitochondrial metabolites, you know, metabolites related to energy production, but it means that there's not enough mitochondria present, and I'll show you some examples of that too, okay? So again, for each area that we're examining here, there's a full range from high to low function. High levels of oxidative stress, we all know that's bad. The labs show that, we're gonna treat that, people get better. But what about low levels due to lack of mitochondrial energy production? You can actually have a lack of reactive oxygen species due to a lack of ATP. I mean, to me, when Dr. Lord first asked me that question, he's like, well, Dan, you got to imagine this guy with a really beautiful Southern accent. Well, Dan, you know, obviously this patient has high oxidative stress levels, but that other patient we saw, very low levels. What does that mean? You know, just pushing me to think about it. Could they be too low? And the answer is absolutely yes. Okay, there's a spectrum. In fact, when patients start to get healthier and they start to become more physically active, it's very common, and you should expect to see their oxidative stress markers go up during the treatment plan, right? That means they're getting better, they're using more energy, and maybe now you're going to need to use some antioxidant supplements. Same thing here with the high need for omega-3s, which many of the people that we work with have. Not living in denial of that. We're not saying that's not happening. We're just saying, wait a minute, you can have a large need for omega-3s, but what if the person doesn't need omega-3s and you give them omega-3s? What is the result of that? And I'll point the finger at myself. I, for 20 years, made the false assumption that everybody needs omega-3s, and I sold every patient for a good 20 years a multi-pack that had omega-3s. It was just part of my, like, you're in Dan's clinic, you got to take this supplement, not with any lab testing, just like assuming that everyone needed omega-3s. Now that I've become more sophisticated in the last few years with lab interpretation, I realized, wow, at least I didn't dose people too high. I don't think I probably harmed too many people in any major way. But long-term use of omega-3s, if you're low in omega-6s, is going to cause a major problem because these fats compete for enzymes, right? And so if you've got a lot of omega-3s, you're not going to be able to handle your omega-6s very well. And if you take omega-3s and you don't need them, you're going to end up causing a problem on the omega-6 side. Okay. And again, the high mitochondrial markers we're used to seeing on these organic acids tests. And in fact, when Dr. Lord first developed these tests, 30, 40 years ago, that was a breakthrough idea. Wow, that marker for CoQ10 is high. That patient needs CoQ10. That's pretty amazing. They need magnesium. And we really started to understand it that era. This is like, I guess in the 80s, yeah. Early 90s, really started to understand that there were these nutrient markers that were really quite accurate, and we could give people mitochondrial support and their energy systems would come back online, right? Their control of pain and inflammation would start to improve. And so if you can get oxidative stress figured out, the omega-3s and 6s figured out, and get the mitochondria regulated well, your chronic pain patients are going to feel better, and your chronic inflammation patients are going to be less inflamed. These two things work hand in hand. And I think you're going to find pretty much all of your chronic pain and inflammation patients on labs will show a problem with one of these three areas, if not all three. They're going to either be super high or super low in terms of oxidative stress. They're going to either have an omega-3 or omega-6 problem or both. And all of the chronic pain people we work with in general, almost all, are going to have some level of mitochondrial problem. Whether the mitochondrial markers are high or low, that may differ. But as we're looking in depth at these tests, that's that spectrum or that arc that we want to look at. Okay. And then in terms of like, okay, what do you actually do? Here's the what do you do at slide? Treatment options. If it's the mitochondria, we're thinking about free-form amino acids, PQQ, CoQ10, magnesium, some combination of those. And I've been doing these mitochondrial programs more intensively for the last 3-4 years. They work incredibly well. Chronic pain patients, chronic fatigue patients, depression patients, getting the mitochondria working makes a huge difference for people who are in pain and inflamed. Okay, then the second category here, oxidative load. What actually is the treatment? Well, it depends. You can use either water-soluble or fat-soluble antioxidants, or perhaps you want to use both. Okay? And again, assuming that their oxidative load is high, we're going to give either water or fat-soluble antioxidants. And you can get, if you want to get really specific, you can even figure out how to, differentiate between those two options. Okay. And then on the inflammation side, the obvious thing, we want to figure out the omega-3, omega-6 balance. But now we're trying to think, well, wait a minute, maybe we should test and not just guess. So pain, inflammation, oxidative stress, and mitochondria are all linked. And I can't tell you how many dozens of maybe even hundreds of hours of lectures I've sat through from world-leading experts talking about pain or talking about inflammation or talking about oxidative stress. And at some point in functional medicine, you just throw your hands up and you realize everything causes everything and it's all connected, But these are really clear and obvious connections where when we're in chronic pain, there's going to be some level of neuroinflammatory blah, blah, blah. There's going to be inflammation. There's going to eventually be problems with the mitochondria. There's going to be problems with oxidative stress. And you end up on this, really downward spiral, downward spinning kind of cycle, right? Where the one causes the other. And the inflammation makes the pain worse. The pain makes the inflammation worse. And everything just targets your poor little mitochondria just sitting there trying to do their jobs. And they're getting whacked about, right? And then all of a sudden the oxidative stress goes around. And so these are all three linked, obviously. But what's really interesting, I think, and what, I don't know, I want to, maybe enjoy is not the right word, but yeah, I do. I like enjoy this, is seeing how this manifests in different patients in different ways. And then getting a really targeted supplement program and just sitting back and then seeing what happens. I mean, not that it's entertaining, but it's pretty amazing to watch what happens when you dial this in so specifically, okay? So now we're thinking about sources of inflammation and why does this even matter? Well, it could be impacting your brain. Brain inflammation, not so great, right? It's going to cause depression and anxiety. It could be inflammation that's directly related to toxins. It could be inflammation because of some kind of neurohormone imbalance. And probably the favorite in functional medicine is just to blame everything on the gut, right? So if you're inflamed in your toenail, is all inflamed, it's probably because of a gut infection. And I'm only half joking there, right? When you get into the microbiome, you start to realize that, well, if your microbiome's not working really well, there's just going to be a whole cascade of problems that's going to go on and on and on and on and on. And so part of the overall functional medicine model is that we're also treating the sources of inflammation. It's kind of not really what we're talking about in today's class specifically, because we want to look at these other areas, but we're kind of assuming that there's this background treatment going on. You're not just trying to give the 3s or 6s and hoping that that makes everything work, but that you're looking a little deeper and figuring out what are the sources of inflammation. However, what I have found, and this has been surprising to me, well, I'll just give you a brief rundown on the history of Dan in practice. So when I first started my practice, I was pretty convinced that I needed to get patients feeling better in the first couple of weeks of treatment, 2-3 weeks max. I wanted a miracle cure. In fact, my original office manager used to call me Dr. Dan the Miracle Man, which was kind of embarrassing. But patients would walk in and she would say, "Oh, you're here to see Dr. Dan the Miracle Man?" I'd be like, "Okay, great, thanks, Marianne." But I really thought that was the goal. And then I learned about functional medicine, and I was like, "Oh no, that is not the point. The point is to find the underlying cause." And as you all know well, that treating the underlying cause eventually helps people feel better, but sometimes the underlying cause treatments make people feel worse. What if they're really toxic in metals and you detox all their metals? They might feel worse before they feel better. So one of the things that sort of come to me in my more mature years of practice is that we're really running two independent things here. We're running a program to make the patient feel better so they keep coming back and they're enrolled and engaged. And we're running a program to find the underlying cause, which is the heart and soul of functional medicine. And if you can learn how to get control over pain, inflammation, and get the mitochondria working well, that'll buy you time, get that person feeling better, so you can figure out whether they have a xylene exposure problem or an arsenic problem with toxins, or they have Giardia or H. pylori infections. It'll give you the time to find the underlying cause and start to treat that, but at the same time, not have that person just feeling worse and worse while you're poking around trying to target the underlying cause, right? So we try to do these things simultaneously in the best of both worlds. 3 potential interventions, right? You can test and correct these 3 factors to reduce pain and inflammation, etc. So the mitochondria, already mentioned, free-form amino acids, CoQ10, MAG, there's a little typo there, it's supposed to be magnesium, oxidative stress, targeted antioxidants, and then low omega-3s. Okay, so these are the 3 things we want to figure out. You can, how do you know when and if and how much of these you should use? And the key to that is not, typically found in personal opinions. The key to that is going to be found in the labs. So these are the labs that I prefer. There are many other companies that do these, or a couple others, but these are the ones that I've just kind of grown up on. Organics with an X at the end and ion panels. These are both done by Genova Lab. And again, there are other lab companies that do organic acids that you can use as well. So let's take a look then at the antioxidant portion of this. And we'll look at a lab report in a moment, but prior to that, let's just think about what are we really doing here. We've got antioxidants that are fat soluble and antioxidants that are water soluble. And there's different ways that you can test for them. And then obviously the ones that are fat soluble play a really strong role in protecting lipids, which we're circling right back to our omega-3s and omega-6s. So if you have a problem with fat-soluble antioxidants, you're going to have damage occurring to your lipids or fats. And the last thing you want if the patient's inflamed and in pain is to have their omega-3s getting oxidized, right? So again, if we go back to the basics here, when you think about these different structures here, let me go back a couple slides there. You think about why are the omega-3s so important? Why are the omega-6s so important? Because the omega-3s and the 6s make up the cell membranes. Every cell of your body has to have these fatty acids in it. And if your oxidative stress is high and you have low levels of fat-soluble antioxidants, then these lipids are going to be a target, right? So you could even have enough omega-3s, but if you have a problem with fat-soluble antioxidants, those omega-3s are going to be damaged, right? They're going to be getting oxidized because you don't have enough fat-soluble antioxidants to protect them. So you can see how this is kind of circular argument here. But the tests help you figure out exactly how you're going to differentiate so you know exactly what you're going to treat. Again, if you have low fat-soluble antioxidants, that in and of itself is going to cause inflammation for a million reasons. In addition to the fact that it means that you cannot protect your cell membranes or lipids, and your omega-3s are just going to be getting damaged or oxidized. They're going to be physically under attack. So we look at the lab here. Let's see. Oh, and then we can talk about the water soluble. Well, let me just mention the water soluble ones real quick first, because then we're going to look at the labs for both those. Okay. So the fat soluble ones obviously are protecting lipids or fats. The water soluble ones are going to be protecting what? The cytosol of the cell, right? So here's the classic one, vitamin C. Right? So that's going to be protecting the watery portion of the cell. And what are we really worried about inside the cell here? We're worried about the DNA. And you don't want your DNA being damaged, right? So water-soluble antioxidants are very important for protection. Fat-soluble ones are very important for protection. And they have slightly different roles in this whole thing. And we measure them separately. So you can treat them separately. But knowing that the fat-soluble antioxidants are low, lets you know that you should have some extra concern for what's happening with your lipids, right? And we're right back to omega-3s, we're right back to worrying about inflammation. So in other words, you can have a normal amount of omega-3s in your system, but if they're getting damaged because of lack of fat-soluble antioxidants, you got a problem. And what are those fat-soluble antioxidants, you may ask? CoQ10, vitamin E, vitamin A, beta-carotene. Makes sense, right? And they are going to be directly related to this marker called lipid peroxides. That's a marker that shows the amount of lipid oxidation, the amount of damage that's occurring to the lipids. So what's happening is your lipids are just sitting out there, just trying to live their own little private lives, right? And then free radicals are coming to potentially damage them. And we have these fat-soluble antioxidants that are protecting us against that mechanism of damage from occurring. Okay, then on a slightly different, but obviously related page, we have water-soluble antioxidants, and those are tracked with a couple of markers on these labs. There's one marker that's a very direct measure of the activity of vitamin C, okay, and then there's another one that's extremely famous called 8-OHDG. And 8-OHDG, or 8-hydroxydeoxyguanosine, is a marker for oxidative stress, in particular water-soluble. Right? And a lot of the brands that we use, a lot of the companies that we use, you may have an antioxidant that has all this stuff in it, but I think it's kind of cool to be able to differentiate between these, because if you have a major fat-soluble antioxidant crisis, you're thinking about inflammation and damage specifically around lipids. Now you really got to be on high alert for your omega-3 problems, right? And if it's a vitamin C marker or 8-OHDG, you're thinking water-soluble antioxidants, you're thinking, oh man, that's actually a little more critical even for DNA damage, a little bit different, okay? A little bit different, slight subtle differentiation there. Okay, so now this is from an ion panel from Genova Lab, and you can see that when Dr. Lord designed this test, they clustered all the fat-soluble antioxidants in this one little section. How convenient is that? And here's our CoQ10, alpha and gamma tocopherol, the vitamin E markers, vitamin A, and beta-carotene. And conveniently, I picked one that was low. This is a real patient of mine. And you'll see that 3 of the 5 fat-soluble antioxidant markers are low. Right? That is not a good thing. That means that this person's lipids are unprotected and they're going to be damaged because of oxidative stress. So then we're thinking, how's that affecting lipids directly? Lipid peroxides, again, a measure of oxidation or damage to the fats, is high. That's a crisis. These two are directly related. If you can bring up the fat-soluble antioxidants, the damage to the lipids will drop. And what's going to happen in terms of inflammation? They're going to get better for like a gazillion reasons. Number one, because the antioxidants have anti-inflammatory properties themselves. And number two, because the antioxidants are going to lower the lipid peroxides, which is going to protect the lipids or fats, which we're right back to the circular argument that are omega-3s and whatnot, right? So you're protecting the stuff that's anti-inflammatory. Pretty cool. So now, okay, now I'm just going to take a moment here to take a deep breath, because if you've been in practice for a while and you've been looking at these labs for a long time, then I think what I'm about to say is going to be super cool. If you're relatively new, you're in your first year of practice or something, I don't know, take a break, go on YouTube for a minute, watch a 3-minute video and come back or something, because this is a little mind numbing. But I want to present this because it's like kind of an advanced concept that we should all really know. So now we're treading into Dr. Lord land, right? And now we're saying, okay, well, this patient, low CoQ10, low gamma tocopherol, low beta carotene, clearly the fat-soluble antioxidants are low. That's not good. So now we're thinking, well, after what Dan just said, lipid peroxides are going to be high because the lipids are getting damaged. But lo and behold, they are not high. Okay. In fact, they're low. They're in the lowest quintile. How could that be? How could you have insufficient fat-soluble antioxidants? So your fats are just sitting out there totally unprotected. Your 3s or 6s, all your inflammatory control mechanisms are just getting nuked constantly from all these oxidative stress processes. Then why isn't this high? Okay. And this is a moment where if we were doing a Dr. Lord class, he would pause and he would shut up, and then I would be stammering and trying to come up with an answer. But I'll give you the answer is that every single one of these patients that you see with this pattern is going to have low essential fatty acids. So this is just one of these mind-numbing things, okay? Is that if your omega-3s or omega-6s are really low, lipid peroxides can show a false negative. When you start to give this patient 3s and 6s, or 3s or 6s, whatever they need, this marker is going to come up. Okay, so in other words, if you don't have enough 3s and 6s, those levels are really low, lipid peroxides may look fine, and it doesn't make sense unless you look at the next page of the lab and you'll see that their 3s and 6s are low. Okay, so that's just another thing to keep in mind. And I think you'll find, as I have, the vast majority of people who have low fat-soluble antioxidants but low lipid peroxides are also going to have low omega-3s and omega-6s, okay? And I think, yeah, I have some of those coming up in a little while. We'll have some examples of that too. All right, so now here's, again, classic organic acids profile. Now we're looking at oxidative stress, water-soluble compartment, right? Water compartment. And I understand this is somewhat of an artificial distinction because it's all kind of happening in the same place, but it's just a convenient way, I think, to think about it clinically, so you can separate these things in your mind. Oxidative damage, so we have para-hydroxyphenolactate. If that marker is high, then in general, we usually recommend vitamin C. You guys have probably heard that before. And this is our 8-OHDG, 8-hydroxy-2-deoxyguanosine. Nobody really wants to say that, so they abbreviate it 8-OHDG. And one of the greatest clinicians and teachers of our time, Walter Crinian, who died recently, I had the great privilege to see him on stage many times, but I saw him on stage in New York City a couple years ago. If you guys don't know Walter Crinian's work, you should really look him up. I'm sure someone's carrying on his work after his death, but like I said, the fathers, grandfathers, founders of environmental toxicology. And I saw a lecture in New York, and he spent 3 hours just talking about this marker and barely scratched the surface of all the research, thousands of research studies on why this marker is important. And if this goes high, its implications for everything from breast cancer to diabetes to cardiovascular disease. Thousands, I guess probably tens of thousands of research studies on this marker here in the scientific literature. So it's a very, very, very important marker, very well known in people who study oxidative stress. So anyways, if that one's high, or if marker number 28 there is high, then we're thinking about, again, oxidative stress. Now, but let me just mention one other thing. If this marker is low, let's say this marker is super low, really low, not in the mid-range, but really low, can you guarantee that that's a good thing? Absolutely not. If 8-OHTG is extremely low, your little spidey senses, your little functional medicine spidey radar should go up, and you should think, okay, that probably is a good thing, should be a good thing, but is it, right? And then how are you going to figure out if that's a good thing or not? The answer is that you're going to go right over and look at the mitochondrial markers. So again, this is a ion panel or organics profile from Genova. Many of the other companies have similar ones, but I just prefer these tests, so I use them in my slides, you know. So again, low 8-OHDG, got to think about that. We'll come back to that in a minute. So lipid peroxides, what are we looking out for? We're looking at the measure of cell membranes being damaged by free radicals. That's a pretty amazing thing. You think about how important cell membranes are. Well, first of all, why are they important? Well, every cell has to have one, right? They're kind of like, I don't know, they're controlling everything that's going in and out of the cell. They're responsible for pumping things and moving things and helping things diffuse. And if the cell membranes are not functioning well, there's absolutely no way that the cell is going to be functioning properly, right? They're very, very, very important arbiters of our overall health. So a high level of lipid peroxides, again, means there's damage, an increased amount of damage to the lipids or fats. And that is bad. And for that, we want to treat with fat-soluble antioxidants, right? And the patients will get better, and they'll have less joint pain. They'll be less inflamed. You know, good things will happen if you do that. And if you're treating with antioxidants and good things are not happening, you're probably underdosing them. So, you know, call one of your local sales reps for a supplement company or talk to a doctor down the street and get that person on a therapeutic dose. Make sure that you get them on a decent enough dose of all this stuff. And this is what we do in my mentorship class. And I find that the year-long mentorship I teach, one of the most common things that we see in programs that aren't working is that people are just underdosing patients because they're not sure about how much to give, okay? So just make sure you get them on what I call a therapeutic dose. Now, don't overdose people. Clearly, you're not going to hurt anyone here, but you got to get a level that's going to be therapeutic. Low levels, right, with low fat soluble antioxidants and low EFAs means that when you start to give the essential fatty acids, you're going to start to see things change. So what do I mean by that? So if the lipid peroxides are high, you know they need fat soluble antioxidants. If the lipid peroxides are low, then you got to think, is that a good thing or not? Just like with oxidative stress. Oxidative stress is high, you know they need antioxidants. 8-OHTG is high, you know they need antioxidants. 8-OHTG is low, you're thinking, what's the problem here? Is there something that I'm missing? Is there something else that's going on? And we'll look at the same kind of spectrum or arc in one other example with mitochondria. So, and these are all linked again. So you have mitochondria, and if they're healthy, they're generating free radicals or oxidative stress or reactive oxygen species or whatever you want to call these things, right? So the byproduct or part of the process of making ATP is that your body spits off all these free radicals. And in a healthy tissues, a healthy body, you're eating your broccoli every day, you're eating your green beans every day, it's not a problem because your antioxidants are protecting everything. Okay? But where we're worried about things is when this whole system starts to break down and the normal production of energy is not happening, right? And that's going to lead to a tremendous amount of free radicals. And this is going to be happening in the majority of chronic pain patients. You're going to have less ATP. You don't have a lot of people in chronic pain that are full of energy and really in a great mood, right? They're going to be tired and depressed as their ATP supply shrinks. And they're in pain and they're tired and they're depressed, and it's all kind of coming down on them. And the free radical damage is just going to be exponentially increasing and increasing and increasing as the system starts to fall apart. Okay, so mitochondria and oxidative stress are tied together, and again, all three of these subjects interact and interweave in really complicated ways. So mitochondria markers pretty straightforward. So you have energy production markers, and they're going to play a very important role in controlling inflammation. They're going to play a really important role in the development of different kinds of pain syndromes. So now, in the sort of classic way that we've all been trained in functional medicine is that you see these high markers, right, on the mitochondrial marker section. And then you're thinking, okay, well, that's bad. And so we're going to give some supplements to kind of reverse that. And so mitochondrial functions such as energy production, intracellular mobilization, these all play super important roles in the development of pain. Okay, and you can have high organic acid markers for mitochondria. That means that there are low nutrient levels. Okay, so high organic acids markers for mitochondria equates to low CoQ10, low B vitamins, low magnesium. That we can understand. The next part is the complicated part. Patients can have a pattern of extremely low markers, which is typically even worse than the high markers, demonstrating a reduced number of mitochondria. Okay, so what are we actually measuring here? We're measuring these different phases of energy production, these different stages: adipate, subarate, ethylmalonate, pyruvate, lactate, citrate, cis-iconatate, right? All these are little steps in energy production, ultimately resulting in ATP. And when one of these steps gets blocked, I don't know, let's say you don't have enough carnitine, okay? Not enough carnitine in the person's body, then these markers are going to build up because there's a block right here, okay? Well, you might not have enough magnesium, then one of these markers is going to build up. So as nutrient deficits rack up, these metabolites go high. So you see a high marker on organic acids, you know there's a nutrient deficit. And you can see that right here in this example, where we're measuring the citric acid cycle, and you see all these high markers. That means that the person is deficient in B vitamins, CoQ10, magnesium, probably amino acid. You give those nutrients, the person's pain will get better. They're going to feel less inflamed. They're just going to be happier, nicer human beings because they're making cellular energy properly. The three big ones for mitochondria are CoQ10, magnesium, B vitamins, right? Those are super important. And then oxygen's pretty important too. Now we're on the wait a minute. The other, you know, if these high markers mean something, what do the low ones mean? And so when these tests were first developed by Dr. Lord, they didn't know that these low markers were significant. But you see this patient, low, low, low. DL means beneath detected limit, first quintile, undetected, undetected, low. You get patients like this and you're thinking, well, that doesn't look so bad. At least they're not high. Maybe their mitochondria are okay. Absolutely not. All the latest research now shows that this is what Dr. Lord calls a hypometabolic state. Hypometabolic state, meaning there's not enough mitochondria present to make these reactions move forward. And there's a very straightforward solution. You can give large single dosages of free-form amino acids along with PQQ, magnesium, and CoQ10, and you will see these people in 6 months turn around. And I have all kinds of case studies in my classes now to show this. You'll see these markers coming up as their energy production starts to improve. So high levels are bad, low levels are even worse. Again, there's a spectrum. If you don't have enough mitochondria present, you're not going to be able to make energy, period. And these markers are going to look suspiciously low, okay? I think I'm kind of cramming a lot into this talk. I apologize for that, but I wanted to tell, you know why I did it this way is because I'm trying to provoke the thought process. Like, okay, we know high is bad, but does that mean low is good? You know, just to think this through. I'm showing you example after example where we want to kind of question ourselves. So with the omega-3s and 6s, same kind of thing. We just are always thinking omega-3s are great and omega-6s, yeah, not so much. Stay away from those 6s, get plenty of 3s, your inflammation will get better, right? That's just the general assumption. However, sometimes it doesn't work like that. Now, this particular case, these are omega-3s, alpha-linolenic, EPA, DHA, right? Some patients are really low. This is like a no-brainer lab. You see this, you give them a high dose of omega-3s for 3 to 6 months, they're gonna get better, right? Do you do that forever? No, you just do it for 3 to 6 months and you'll start to see them getting better, right? The question then becomes, with this person here, What if these levels were normal? Would the omega-3s be good? Maybe, maybe not. We don't really know, right? It's possible. You might get an anti-inflammatory effect from the omega-3s even though they're not deficient in them, right? You don't just have to give 3s to people who are deficient in 3s. They're going to have an anti-inflammatory effect on everybody, whether you're deficient or not, right? So that's another thing to kind of think through. But to provoke the thought process here, arachidonic acid low, and that's like saying not enough oxidative stress. We don't even have a word for this. Underinflamed, can that even happen? I don't know. Let's look at the labs. Yeah, you can have not enough omega-6s. You can have not enough arachidonic. Could this person be in pain? Absolutely. Could they be kind of inflamed? Yeah, kind of. But their inflammatory process is messed up in an atypical way, right? And the only reason I'm bringing this up is because you don't want to give this person massive dosages of omega-3s because it's going to drive the 6s down more, okay? So you have to be on the lookout and do the labs, basically just do the testing. The omega-3s in high dosages may help in the short term, but they're going to drive the 6s lower, and that could cause some problems down the road, right? And let's see, lipid peroxides when giving omega-3s. Oh, we already talked about that, right? I talked about that like a million times. So let's do a quick review here, and then I'll open it up for questions. Oxidative stress indicators. By the way, I've been doing these labs for a long time, but in the last 3-4 years, I've been really carefully studying these tests. They're incredibly accurate. I would stake my career, reputation, life, financial future on the accuracy of these labs. They really work. And so I think part of the learning process for all of us is just having absolute confidence in the tools that you use, just absolute confidence. And you can, really get clinical results that are quite dramatic if you understand how to interpret these. So quick review, oxidative stress indicators. The antioxidant markers, CoQ10, vitamin E, A, beta carotene. Remember, those are the fat-soluble ones. They're going to protect your lipids or fats. We've got the 8-OHDG, the para-hydroxyphenolactate. Those are the ones that are a little bit more in the water compartment side, but equally important, perhaps, I don't know, some people might argue even more important. We've got mitochondrial markers that can go high or low. We've got the omega-3s and the omega-6s, which you want to look at carefully and just treat based on what the labs show. And you'll see every possible imaginable combination of these different things. So for example, you will see some people that have omega-3s that are low, and they're low in 6s. So you give them both. Then they get better. You will have some people who are low in 6, but the 3s are high because they've been taking fish oil. I see this all the time. Sally, your omega-3s are really high. What have you been doing? And Sally's like, I've been taking fish oil every day since 1957. And you're like, Sally, I think you should stop, okay? Because long-term use of excessive omega-3s can lower omega-6s, okay? So you can have too much of a good thing here. You might have some people who are just low in 6s and their 3s are normal. And then you might have some people that you would expect, this is what you'd just expect intuitively, that are low in 3s and their 6s are fine. So you just leave their 6s alone. But any one of these things is possible. And so you're just going to treat based on what the labs show for 3 to 6 months and then stop and reevaluate. Okay. And then, to answer Stephanie's question, lack of omega-6 in the diet can cause low omega-6. Genetic defects or SNPs can cause low omega-6, and excessive omega-3s can cause omega-6. So there's a lot of different reasons why 6s could go low. Or it could just be a gut absorption problem, right? The gallbladder's not working, and so they're not absorbing fat very well. So let's see here. Next page here, product categories. The anti-inflammatory indicators, you're going to either get 3s or 6s. 3s are fish oils, right? EPA, DHA. 6 means, in my world, I usually use GLA for omega-6. You could use evening primrose oil too, I guess. On the mitochondrial support side, if you see highs or especially lows on those markers, you're thinking amino acids, CoQ10, magnesium, you're thinking PQQ. And then if you see a lot of oxidative stress, you can use things like vitamin E or CoQ10. You have a pretty wide range. And I like lipoic acid. Lipoic acid does so many different things, right? So you have a lot of different options there. But the main point here as a take home is that as we're looking at all these labs and we're thinking about how all this actually works in the body, that everything from mitochondrial function related to chronic pain, from inflammation related to chronic pain, and oxidative stress related to chronic pain, those are all on a spectrum. And so in the beginning years of doing this work, let me go back to my key slide here. Yeah, in the beginning years of doing this work, you can keep it simple. You see high mitochondrial markers, you give people CoQ10, magnesium, maybe some amino acids and B vitamins, they're gonna get better. You see high oxidative stress, give them antioxidants. You see low omega-3s, you give them the omega-3s. That's like far advanced beyond most practitioners out there that are trying to treat chronic pain, right? You're already so far ahead of the game if you're just doing that. But what I want to introduce for those of you, especially that are highly experienced in this kind of work, is that the mitochondrial markers can be too low, and that's a problem. Oxidative stress markers can be too low, and that's a problem. And omega-6s can be too low, which means you got to question your use of omega-3s, right? So that's kind of like the higher level take home. Okay, so now I want to open it up for some questions here, and I've seen some that are coming in. Cardiac patients, recommendations for cardiac patients to have 1-to-1 ratios for 3 to 6s. I don't know, like 10 years ago, I would have thought, I don't know, that sounds about right. But now that I've been doing these labs so in depth, you just can't tell looking at somebody whether they need 3s or 6s. Some people we work with, I'm telling you, just need high dosages of 6s. And they may even have high levels of omega-3s from over supplementing for decades with fish oil. It happens all the time in my practice. I get some of my most healthiest, quote unquote, patients who are like the health food store junkie kind of people. This just happened yesterday in my practice. And this woman's 3s come back. I'm not making this up. Her omega-3s were just so ridiculously high. And like, Jenny, what are you doing? And I'm not making this up. This is a true story. She was doing a quarter, not a quarter tablespoon. She was doing a quarter cup to a half a cup. This is not funny, but it's kind of crazy, of flax seeds every day. That's amazing. It's amazing her intestines didn't just like get up and leave the room, right? But she's doing like at least a quarter cup of flax every day for who knows how long. That is not necessarily a super healthy thing. Okay, I do a tablespoon of flax every morning. My omega-3s are fine. Okay, next question here. Let's see. How do you discern whether or not patient needs primarily 3s or 6s? I think we answered that probably with, it's just all based on the tests. And to answer Chris's question, yeah, these are Genova labs. Let me show you this slide. It's the organics profile from Genova and the ion profile from Genova. And these are what I teach in my mentorship. If you guys want to get an inside scoop, you can sign up for one of my classes. Ideal ratio. So absolutely, if the omega-6s are low, think about the things it could be. We're all hyper paranoid about the gut. Could be just as simple as gallbladder not making enough bile, and so they're not absorbing their fatty acids very well. They're not absorbing fat very well. So it could be a gut problem right off the bat. You should rule that out. Low omega-6s could be dietary, but we're thinking maybe more absorption. And you will have some people who have these complex genetic disorders, SNPs, we call them these days, right? Where they have a genetic problem and they're not able to manufacture or process omega-6s in the way that one would hope. So it could be genetics, could be dietary, could be malabsorption, could be use, I guess, like you're using up too much of them, but maybe not too many. Is there a guide available that explains every ion marker? Yeah, there is. If you just, and I see it online all the time. It's a PDF. If you just type in like ion panel guide, it should pop up as a free download. Do the testing kits evaluate for all the testing marker? Yeah, so every marker I just showed today is on the ion panel, okay? And of course it includes, another 100 extra markers I didn't show, but everything that I showed today is on an ion panel, okay? And if you guys get super enthusiastic about this, what we do at the Kalish Institute a lot is I do these free webinars, and we have practitioners submit labs. If you run an ion, you're not sure how to read it. And every couple months we try to do one of these, and I can show you that way how to interpret the test, okay? Because it's complicated. Looking at more questions here. I missed what you would do if oxidative stress is too low. Okay. Let's think about that one. What does that mean? Hang on, let me go back here. That's a really good question. So what if you don't have enough mitochondria present? So mitochondrial retraction, or what Dr. Lord calls a hypometabolic state. There's not enough mitochondria around. That means you're not going to have enough oxidative stress. In fact, we need small amounts of oxidative stress to be healthy, right? It's not a zero is better kind of game. So if there's not enough oxidative stress and that person has a hypometabolic state, now these two things have to be paired together. So let me just show you here. I don't want to mislead you guys. This is a hypometabolic state. These are the mitochondrial markers and they're all low. That means there's not enough mitochondria around. If you have that and the oxidative stress levels are low, then you're going to go on a repair the mitochondria program. And you're going to build up those mitochondria with supplements, diet, and exercise. And then the oxidative stress will come up a notch or two, and the mitochondrial markers will come up a notch or two. However, just to be clear, you could have, sorry, I'm just jumping around, let me find the right one here. You could have really low oxidative stress in someone who's healthy. It's just a problem if there's not enough mitochondria, okay? So it's contextual. Let's see here. What do you use to increase omega-6s? Again, I'm just lazy. I do the same thing. I just use use GLA. In terms of when to take B complex, Bs are usually better breakfast and lunch, always with meals, you know. Have you noticed specific organic acids profiles in patients suffering from rheumatoid arthritis? No, I don't know that you say that there's an exact pattern for that. It seems to vary from person to person. What do you provide in supplement support if 8-OHDG is high? That was Michelle asking. So here we go, 8-OHDG right here. So if this is high, I like to use broad spectrum combination products that cover a whole bunch of things at the same time, rather than the single ingredient product usually. So most all the companies that we work with will have like super antiox or detox antiox or antiox plus or support antiox or antiox boost or something like that. And you know, any one of these good companies is going to have a good formulator, and you'll see, look at the label, it'll have like CoQ10, lipoic acid, maybe some A, some E, you know, broad spectrum antioxidant formula. So I'll use something like that. And then the question is, how high do you want to dose it? And if their 8-OHDG is very high, I get pretty aggressive with the dosing under the requirement that the patient has to do a retest in 3 to 6 months. So these supplements work really well, all right? And if someone's up here and you put them on a supplement program and 6 months later they're down here, they're going to stop taking those antioxidants. If they stay on them for another 6 months, you're going to drive it down even more, which is not necessarily good, right? So these therapeutic programs are monitored and validated by the follow-up testing every 3 to 6 months. If someone has high 8-OHDG and you put them on a super potent antioxidant and they take it for 3 years, who knows what's going to happen? It's not very responsible. We don't want to do that, okay? What is your go-to vegan supplement for threes? So just full disclosure, I am like a part-time vegan. I really am. I can last probably at least 5 days a week without meat, but by the time the weekend comes around, something bad's gonna happen. It's gonna be like some carnitas somewhere at a restaurant or a really nice steak or something. So I do eat meat, but not too much of it. In terms of vegan, so I very strongly support vegans, even though I'm an aspirational vegan. I haven't really achieved that level of consciousness yet. But vegan supplementation for omega-3s, I think the easiest thing is just a tablespoon of flax every day. If they don't want to take pills. If they're okay, if it's easier for some reason for them to take pills, then I'll have them do, you know, again, all the companies that we work with will have either a standalone flax oil product, or they'll have one that's a combination of plant-based omega-3s, you know, all together. That seems like an easy one though to do with food if they're willing to grind up flax seeds in the morning, you know, and not have to have them take an extra product, you know, supplement-wise, right? Okay, 1 or 2 more questions and we'll wrap up, just getting short on time here. And is there a routine supplement to give patients who have had their gallbladder removed? Yeah, absolutely. So, and first of all, let me say that gallbladder problems, well, if I look back on my most notable failures in practice over the last, I don't know, my memory doesn't go back 20 years. Let's say go the last 10 years. A large percentage of my really major failures in practice were people who had big time gallbladder problems and I missed it. This would be a lecture for another day, but you can see it on the stool testing that we all do. If you ever see a hint of a gallbladder problem or even think about a gallbladder problem, you really want to treat gallbladder because gallbladder can cause what we call SIBO, right? Because the bile is responsible for keeping the bacteria in the small intestine under control. Gallbladder problems can cause omega-3 and omega-6 imbalances like we're talking about today. Gallbladder problems can cause hormone issues. Gallbladder can cause a lot of stuff. It's a really tricky little organ, and when it's not working well, it causes a lot more problems than you would think. So anyways, I use a combination product. Again, I like the combination products. All the companies will have it, and they're going to be a combination of things like beet leaves, maybe some turmeric. Sometimes they'll have some vitamins or minerals in there for the gallbladder support. Most of them also are going to have some actual bile acids, which of course vegans aren't going to want to do, but they have non-meat related or non-animal product related ones too. Okay, let's see. A couple other questions came in. Let's see. Sunflower seed oil, yeah, more power too. That's a great one. Yeah, sunflower seed oil is a good one. If for omega-6s, right? Raw vegan vitamin D. Yeah, I've never used that. I do take D, but I don't take a vegan one. Let's see. I think we got all the questions covered here. Hey, you guys were great. Thank you very much. This will be recorded. I'm sure we'll send out copies of the recording. If you guys get more interested in the work that I do, go check out the Kalish Institute. See, there's one more question maybe I missed here. Oh, here. How can you be sure that the DNA, the 8-OHTG level is relevant and not reflecting non-coding DNA? I don't know the answer to that. You have to call the lab guys. Lab guys know the answer to that. I'm not up on the differences between those kinds of things. But it's a mass spec test for sure. Technical questions, the lab guys should be able to handle that. Okay, take care, gang. Hope you're all doing well, and I look forward to talking with you at a future talk. Take care.